Alcohol is one of the most widely consumed substances in the United States. While occasional drinking is socially accepted, what happens when you drink alcohol every single day for 100 days? This experiment would have significant effects on your body, mind, and overall health. Many Americans enjoy a glass of wine with dinner or a beer while watching a game, but drinking alcohol daily for a prolonged period can lead to serious health concerns. Let's take a deep dive into what happens to your body during and after 100 days of consistent alcohol consumption. The first 30 days, the early effects. Days 1 to 10, the initial impact. The first few days of daily drinking might not seem like a big deal, but your body begins to experience subtle changes early on. Dehydration. Alcohol is a diuretic, leading to frequent urination and water loss, which can cause headaches, fatigue, and dry skin. Sleep disruptions. Alcohol interferes with REM sleep, leaving you groggy and unrest. Digestive issues. Your stomach lining becomes irritated, leading to acid reflux and bloating. Increased caloric intake. Alcohol is high in empty calories and sugar, contributing to weight gain if not managed. Days 11 to 20. Building tolerance and liver strain. By this stage, your body starts adapting to the daily alcohol intake, but not in a positive way. Increased tolerance. You need more alcohol to feel the same effects as before. Liver overload. Your liver works overtime to metabolize alcohol, potentially leading to fatty liver disease. Weakened immune system. Alcohol disrupts immune function, making you more susceptible to illness. Mood swings and anxiety. Neurotransmitter imbalances cause irritability, mood swings, and increased anxiety. Days 21 to 30, cardiovascular and cognitive effects. After about a month, the impact of alcohol starts to become more severe. High blood pressure. Alcohol consumption raises blood pressure, increasing the risk of heart disease. Cognitive decline. Memory, concentration, and problem-solving abilities begin to decline. Digestive disruptions. Gut health deteriorates, leading to bloating, constipation, or diarrhea. Skin deterioration. Puffiness, redness, and breakouts increase due to dehydration and inflammation. The midway point, damage accumulates. Days 31 to 70. Days 31 to 50. Emotional, social, and physical consequences. At this stage, daily alcohol consumption begins affecting your relationships, work, and overall well-being. Relationship struggles. Increased mood swings, irritability, and prioritizing alcohol over social interactions strain personal relationships. Work performance declines. Alcohol's impact on cognitive function leads to reduced productivity, lack of focus, and potential absenteeism. Mental health declines. Anxiety and depression symptoms become more pronounced. Loss of enjoyment in activities. Alcohol starts replacing hobbies, interests, and other fulfilling activities. Days 51 to 70. Alcohol dependency and serious health risks. By this point, drinking daily for over 2 months is likely leading to physical dependency and significant health issues. Cravings and withdrawal symptoms. Your body starts to depend on alcohol, leading to withdrawal symptoms like headaches, irritability, and nausea if you skip a drink. Liver disease progression. Fatty liver may develop into alcoholic hepatitis, an inflammatory liver condition. Increased risk of heart problems. Alcohol weakens the heart muscles, potentially leading to arrhythmias and an increased risk of stroke. Weakened bones and fracture risk. Alcohol disrupts calcium absorption, increasing the likelihood of osteoporosis. Immune system suppression. Frequent illnesses and longer recovery times become more common. The final stretch, severe and long-term consequences. Days 71 to 100. Days 71 to 90. Long-term health risks intensify. As you approach the 100-day mark, the cumulative effects of daily alcohol use become more alarming. Severe digestive issues, chronic acid reflux, nausea, and potential ulcers develop. Weight gain and metabolic slowdown. Alcohol's impact on metabolism leads to stubborn weight gain. Brain fog and memory issues. Reduced cognitive function makes it harder to concentrate and remember things. Social isolation. Drinking becomes a priority over maintaining healthy relationships. Days 91 to 100, the body nears its breaking point. By the end of 100 days, the body is struggling to cope with daily alcohol intake. Increased cancer risk. Alcohol is linked to liver, breast, and throat cancers. Severe liver damage. Cirrhosis, a potentially fatal liver disease, becomes a real danger. Mental health collapse. Severe depression, anxiety, and paranoia may develop. Financial and social consequences. Increased spending on alcohol and social withdrawal may harm long-term well-being. What happens if you stop drinking? If you quit after 100 days, your body will begin to heal 24 to 72 hours. Withdrawal symptoms such as headaches, nausea, and irritability appear. 1 to 2 weeks. Sleep improves, energy levels rise, and skin appears healthier. 1 month. Liver function starts recovering, and blood pressure stabilizes. Several months. Risk of serious diseases decreases, and mental clarity improves significantly. Is it worth it? While occasional drinking is not inherently harmful, daily alcohol consumption for 100 days can have severe consequences. The risks far outweigh the temporary pleasure, and long-term drinking can cause irreversible damage. If you or someone you know is struggling with alcohol use, seeking professional help can make a difference. Would you take the 100-day challenge? Or is it better to enjoy alcohol in moderation? Let us know your thoughts.